Note to the reader. This year's annual summary of vital statistics article represents a major departure from all previous versions. We wanted to acknowledge the end of the century by taking advantage of the long-term trend data to reflect on the major improvements that have occurred in the health of Americans over the century. This year's article could be called a centennial summary of vital statistics. Mortality and life expectancy. The overall improvement in the health of Americans over the 20th century is best exemplified by the dramatic changes in two measures. 1. The age-adjusted death rate, and 2. Life expectancy. Figure 1 shows the virtually continuous decline in the death rate throughout the century, and the corresponding increase in life expectancy over the same period. The age-adjusted death rate declined by about 74%, while life expectancy increased 56%. Decline in the death occurred at an almost constant rate of change until approximately mid-century. At that point the rate nearly leveled off and then began another decline from the late 1960s to the end of the century. The sharp spike in mortality in 1918 and the concurrent decline in life expectancy reflect the worldwide influenza pandemic. Life expectancy in the 20th century has increased over 27 years, from 49.2 to 76.5 years, and by far the greatest contributions have been from mortality reductions among children. Mortality reductions in the years up to age 20 have contributed about 58% of the 27-year gain, followed by mortality reductions in ages 20 to 39, which contributed about 17%. All in all, the gain, adding more than 50% to our lifespan, has been a triumph of public health and biomedical research. Causes of death. Leading causes of death also show great changes over the century, with a shift from infectious to chronic disease. In the early part of the century, infectious respiratory diseases, pneumonia and influenza, tuberculosis, were the leading causes of death, accounting for nearly a quarter of all deaths in 1900. These were followed by diarrhea, heart disease, stroke, liver disease, accidents, cancer, senility, and diphtheria. By 1910, heart disease had become the leading cause, accounting for more than 10% of deaths. Heart disease has remained the leading cause throughout the century, except for the years of the influenza pandemic, 1918 to 1920. While the age-adjusted death rate for heart disease has declined steadily since 1950, this cause is currently responsible for almost a third of all deaths in the United States. Pneumonia and influenza remained the second leading cause until 1933, when cancer replaced it. The age-adjusted death rate from cancer increased and partly attributed to the increase in smoking over the century. Smoking is estimated to be responsible for 1 out of 5 deaths in the United States, and is estimated to account for as much as 90% of all lung cancer. The 10 leading causes of death in the United States in 1998 were, respectively, heart disease and cancer, followed by stroke, chronic obstructive pulmonary disease, accidents, unintentional injuries, pneumonia and influenza, diabetes, suicide, kidney diseases, and chronic liver disease and cirrhosis. Together their leading causes accounted for 84% of all deaths. Infants' mortality. The infant mortality rate, IMR, deaths in the first year of life per 1,000 live births, has shown an exponential decline during the 20th century. Fig 6 shows the gradual decline in the rate for while, and black infants T in a logarithmic scale. In 1915, approximately 100 white infants per 1,000 live births died in the first year of life. The rate for black infants was almost twice as high. In 1998, the IMR was 7.2 deaths per 1,000 live births, 6.0 for white infants, and 14.3 for black infants, a figure more than twice the rate for white infants. Between the years 1915 and 1998, the overall IMR decreased by 93%, the neonatal mortality rate, NMR, deaths in the first 28 days of life, by 89%, and the post-neonatal mortality rate, PNMR, deaths from 29 days through 11 months, by 96%. During the early part of the century, efforts to improve environmental and living conditions in urban areas were believed to have contributed to the decline in the IMR. Social welfare efforts included the provision of safe milk supplies, parenting education, and improved housing. The provision of comprehensive maternal and infant care that included prenatal and intrapartum care, and postpartum home visits by a healthcare worker may have also played a role in the decline. Finally, medical advances in the 1930s and 1940s, including the introduction of antibiotics, blood banking, and safe blood transfusion, and the development of fluid and electrolyte replacement therapy, undoubtedly accounted for some of the drop in the IMR as well. The decline in the IMR slowed during the 1950s, despite care and increase in the percentage of births that occurred in hospitals. In 1950 through 1957, about half of infant deaths occurred in the first day of life, and many of these deaths occurred in the smallest infants. At the time, there was little survival advantage for hospital birth among these small infants who experienced respiratory diseases. The decline in infants' mortality received new momentum in the 1960s, with the introduction of medical and other federal programs, growing use of family planning services, and changes in abortion laws. There also were further improvements in the living standards and increased education among many segments of the population. More effective management of neonatal problems became available as a result of advances in neonatal medicine. As these advances became implemented in tertiary hospitals, states began an effort to recognize services for the high-risk newborn, to increase their availability to all infants in need. After a slowdown in the decline in IMR in the 1980s, two important changes were noted in the 1990s, related to birth weight-specific mortality rates. First, there was a large decrease in mortality for very low birth weight infants, VLBW, infants weighing less than 1,500 grams at birth, between 1989 and 1990. Although direct evidence is not available, this decline is believed to result from the widespread adoption of surfactant use to prevent or reduce the severity of respiratory diseases syndrome, RDS, in the VLBW infant. Mortality from RDS dropped by 24% between 1989 and 1990, and has continued to decline thereafter. The second change was a drop in the PNMR for normal birth weight infants, between 1989 and 1991. This drop was accelerated in 1992 following the recommendation by American Academy of Pediatrics to prevent sudden infant death syndrome, SIDS, by placing infants on their back or side to sleep. Since 1992, SIDS mortality has dropped by more than 40%. Child mortality. For children older than 1 year of age, the overall decline in mortality experienced during the 20th century has been spectacular. In 1900, more than 3 in 100 children died between their 1st and 20th birthday. Today, less than 2 in 1,000 die. Nearly 85% of this decline took place before World War II, a period when few antibiotics or modern vaccines and medications were available. In 1900, the age-specific death rates for children in the United States were 1983 per 100,000 population for 1 to 4-year-olds, 466 for 5 to 9-year-olds, 298 for 10 to 14-year-olds, and 484 for 15 to 19-year-olds. By 1998, death rates in these age groups had declined by 98%, 96%, 93%, and 85%, respectively. Compared with the other age groups, the decline in death among adolescents has plateaued since the 1960s. At the beginning of the 20th century, the leading causes of child mortality in the 1 to 19-year-old age group were infectious diseases, including diarrheal diseases, diphtheria, measles, pneumonia and influenza, scarlet fever, tuberculosis, typhoid and paratyphoid fevers, and whooping cough. Between 1900 and 1998, the death rate from the major infectious diseases declined 99.7% from 466 to 0.7 deaths per 100,000. The percentage of child deaths attributable to infectious diseases declined from 61.6% to 2%. This decline incorporates the emergence of human immunodeficiency virus, HIV/AIDS, which in 1998 accounted for less than 0.3% of child deaths. Once again, nearly 90% of the decline in infectious disease mortality among U.S. children occurred before 1940, when few antibiotics or vaccines were available. In contrast to the infectious diseases, accidents only accounted for 63% of child deaths in 1900, but 43.9% in 1998. At the beginning of the century, child deaths from accidental injury were likely to occur on a family farm, from fires and burns, of in factories and shops where children were workers. Between 1900 and 1998, the death rate from accidents, now usually called unintentional injuries, declined 2/3, from 47.5 to 59 deaths per 100,000. Although motor vehicle-related deaths were unheard of in 1900, the motor vehicle now accounts for more than half of all injury deaths. Deaths from intentional injuries, including homicide and suicide, are not included in the trends noted above, but accounted for 9.5% of deaths in this age group in 1998. Firearms, as the agent of both accidental and intentional injury deaths, accounted for about 7% of all injury deaths among children aged 1 to 19 in 1998. The major declines in child mortality that occurred in the first third of the 20th century have been attributable to a combination of improved socioeconomic conditions in this country and the public health strategies to protect the health of Americans. These public health measures included the establishment of local health departments in nearly all the states. State and local health departments implemented these public health measures including water treatment, food safety, organized solid waste disposal, and public education about hygienic practices. These improvements in water and food safety and purity are linked to the major decline in diarrheal diseases seen in early years of the century. Similarly, improvements in housing and decreased crowding in U.S. cities are linked to the reductions in mortality from tuberculosis and other diseases, attributable to person-to-person airborne transmission. Vaccination, while first used in the 18th century, became more widely implemented in the middle part of the century. Vaccines against diphtheria, tetanus, and pertussis became available during the late 1920s, but only widely used in routine pediatric practice after World War II. Thus, vaccinations does not account for the impressive declines in mortality seen in the first half of the century. The reduction in vaccine-preventable disease, however, are impressive. In the early 1920s, diphtheria accounted for about 175,000 cases annually, and pertussis for nearly 150,000 cases. Measles accounted for about 500,000 annual cases before the introduction of vaccine in the 1960s. Deaths from these diseases have been virtually eliminated, as have deaths from Haemophilus influenzae, tetanus, and poliomyelitis.